Sinus infection, sinusitis. Definition: in fact, sinusitis or sinus infection is inflammation of the air cavities within the passages of the nose. Sinusitis can be caused by infection, allergies, and chemical or particulate irritation of the sinuses. Most people do not spread sinus infections to other people. Sinusitis may be classified as acute sinus infection, subacute sinus infection, chronic sinus infection, infected sinusitis, and non-infectious sinusitis. Sinusitis signs and symptoms include symptoms of a bacterial sinus infection include facial pain, pus-like nasal discharge, and symptoms that persist for longer than a week and that are not responding to over-the-counter (OTC) nasal medications. Sinus infection is generally diagnosed based on the patient history and physical examination. Bacterial sinusitis is usually treated with antibiotics. Early treatment of allergic sinusitis may prevent secondary bacterial sinus infections. Home remedies for sinusitis and sinus infections include over-the-counter (OTC) medications such as acetaminophen, Tylenol and others, decongestants, and mucolytics. Nasal irrigation can be accomplished with a neti pot or rinse kit, nasal bidet. Rare fungal infections of the sinuses, for example, zygomycosis, are medical emergencies. Complications of a sinus infection that may develop are meningitis, brain abscess, osteomyelitis, and orbital cellulitis. There are no fungal vaccines available to prevent fungal sinus infections. The majority of doctors think that most people do not transmit sinus infections except in rare instances, and conclude that sinus infections are not contagious. Sinus infections usually begin with the symptoms of a cold, for example, a runny nose, occasional cough and/or mild fever, and then develop into pain and pressure in the sinus cavities. About 7 to 10 days after initial cold-like symptoms, other symptoms develop that suggest you may have a sinus infection. Sinus infection symptoms include a yellowish-greenish nasal discharge that may have an odor, bad breath, puffiness around the eyes, headaches, pressure in the sinuses, and coughing. Learn more about sinus infection. Contagious. What are the sinuses? How many do we have? A sinus is a hollow, air-filled cavity. For the purposes of this article, a sinus will refer to those hollow cavities that are in the skull and connected to the nasal airway by a narrow hole in the bone, ostium. Normally all sinuses are open to the nasal airway through an ostium. Humans have 4 pair of these cavities, each referred to as the frontal sinus in forehead, maxillary sinus behind cheeks, ethmoid sinuses between the eyes, and sphenoid sinus deep behind the ethmoids. The 4 pair of sinuses are often described as a unit and termed the paranasal sinuses. The cells of the inner lining of each sinus are mucus-secreting cells, epithelial cells and some cells that are part of the immune system, macrophages, lymphocytes, and eosinophils. Functions of the sinuses include humidifying and warming inspired air, insulation of surrounding structures, eyes, nerves, increasing voice resonance, and as buffers against facial trauma. The sinuses decrease the weight of the skull. If the inflammation hinders the clearance of mucus or blocks the natural ostium, the inflammation may progress into a bacterial infection. 18 signs and symptoms of sinus infection or sinusitis. Readers' comments. 39. Share your story. There are many signs and symptoms of sinusitis and sinus infections. The following is a summary of predominant ones, 18 total, that may occur. Most patients have several signs and symptoms at the same time. Others may have some symptoms that are intermittent. Most do not have all symptoms at once. The signs and symptoms of a sinus infection or sinusitis include the following. Headache due to pressure in partially or completely blocked sinuses. The pain may increase when the person bends down. Facial tenderness and/or swelling when facial areas over sinus areas are touched. Pressure or pain due to mucus pressing on sinus tissue or inflammation of sinuses. Fever due to inflammation of sinus tissues and infection. A cloudy, discolored nasal drainage is often seen in bacterial sinus infections. Congestion is a feeling of nasal stuffiness, and occurs with both infectious and non-infectious sinusitis. Postnasal drip is mucus overproduction from sinusitis that flows to the throat and irritates throat tissue. Sore throat is inflammation of throat tissue by postnasal drip. Cough is a response to postnasal drip and body's attempt to clear out throat tissue irritants. Tooth pain caused by pressure on surrounding nerves and tissues. Ear pain caused by pressure on surrounding nerves and tissues. Eye pain caused by pressure on surrounding nerves and tissues. Fatigue due to fever, immune response and/or coughing. Bad breath usually is due to bacterial infection. Itching, sneezing. In non-infectious sinusitis, other associated allergy symptoms of itching eyes and sneezing may be common, but may include some of the symptoms listed above for infectious sinusitis. Nasal drainage usually is clear or whitish colored in people with non-infectious sinusitis. Ulceration can occur with rare fulminant fungal infections with sharply defined edges and a black, necrotic center in the nasal area. Some fungal infections cause dark, black-appearing exudates. This requires immediate medical evaluation. Multiple chronic, over 1 to 3 months, symptoms usually are a sign of subacute or chronic sinusitis. What is a sinus infection or sinusitis? Inflammation of the air cavities within the passages of the nose, paranasal sinuses, is referred to as sinusitis. Sinusitis can be caused by infection, sinus infection, but also can be